Hello and welcome. I am Dr. Ankit Parakh. I work as a consultant in Pediatric Pulmonology, Allergy and Sleep Medicine at Children's Chest Clinic, New Delhi. Does your child get breathless on exercise? It can be a symptom of asthma. So in this video, we'll talk about exercise-induced symptoms, how do we diagnose them, and how do we treat them. Now, children on exercise can get symptoms of cough, they can become breathless, they can find it difficult to breathe, they can have chest pain or tightness, and sometimes they can have wheezing in the chest. Now, there are two groups of children which we would see. One group of children are children who already have asthma, and that asthma is not properly controlled, and when they exercise, these symptoms increase. But there's a group of children who do not have asthma, but they get symptoms only when they exercise, and that is what is known as an exercise-induced bronchoconstriction. Now, these symptoms of exercise-induced asthma or exercise-induced bronchoconstriction usually start during exercise, but sometimes they start even after the child has done his exercise, within a few minutes. The symptoms can last for a few minutes to up to an hour or even longer. And as I've talked about, the symptoms are usually in the form of coughing, in the form of chest tightness, in the form of a whistling sound produced from the chest, which is called as wheezing, difficulty in breathing, and chest pain. Now, why does an exercise-induced bronchoconstriction happen? Well, the exact cause of exercise-induced bronchoconstriction is something which is not known. It is thought to be mediated by cold and dry air. Now, once anyone is exercising, we tend to breathe fast and we tend to breathe through our mouth. And when that happens, the air which we are breathing in and out does not get warmed and it does not get humidified, which it normally does when we are breathing slowly through the nose. This cold and dry air induces bronchoconstriction in our airways or bronchi, and that also induces some amount of inflammation or swelling. When that happens, the airway becomes tight, they become narrow, and the child finds it difficult to breathe. Now, how do we diagnose a child with exercise-induced asthma or exercise-induced bronchoconstriction? So it starts basically with a detailed case history of what is happening to this child. Does this child is a known case of asthma, or the child is otherwise well but is having symptoms only during exercise? Now, to diagnose exercise-induced bronchoconstriction or asthma, we need a lung function testing, usually in the form of a spirometry. So we perform a baseline spirometry, and after that we perform what is known as a treadmill exercise challenge test. So once the baseline spirometry is done, we would ask the child to exercise on the treadmill for around 6 to 8 minutes on a specific protocol. And thereafter we repeat spirometry testing at 5 minutes, 10 minutes, 20 minutes and 30 minutes post-exercise. In children with exercise-induced bronchoconstriction, we find that the FEV1s would drop by more than 10% post-exercise, and that is how a confirmed diagnosis of exercise-induced bronchoconstriction can be made. Now, if a child has symptoms on exercise, then how do we treat that? Now, in children who have asthma, but their symptoms are not well controlled, they are getting symptoms on exercise because their asthma is not well controlled. In these situations, treating the asthma will improve the symptoms even on exercise, and hence they would need inhaled corticosteroids, usually in the form of an inhaler and spacer. On the other hand, if we have a child where the symptoms on exercise are there, but the child does not have a baseline asthma, in this situation, we would recommend a few steps. A warming up is something which is recommended. So a very light exercise, some stretching exercises are recommended. That actually warms up the body and reduces the chances of having an exercise-induced bronchoconstriction. Now, in addition to this, the child is asked to take a short-acting bronchodilator 15 to 20 minutes prior to exercise, and that is going to relieve or reduce the symptoms of exercise-induced bronchoconstriction. In few patients, montelukast is a medicine that can also be used to reduce these episodes. So if your child is having symptoms on exercise like breathlessness, cough, wheezing, chest tightness, or difficulty in breathing, you need to consult a pediatric pulmonologist or an allergist to make a proper diagnosis and to take appropriate treatment so that the child is able to enjoy his sports, his exercise, and do well in life. For more information, you can log on to our website ankitparakh.com. Thank you.